Hi, Fulvio here, plastic surgeon, and I wanted to talk to you about wound care. If you're looking at this video, you may have a wound, and I'm a plastic surgeon. Plastic surgeons look after a lot of wounds a lot of the time, and we've been doing it for quite a long time, and yet every time we let a patient know how we intend to do it, they kind of interrogate us as if it's the first time we've come across it. So I'm sharing this video with you to hopefully give you some reassurance that we haven't gone totally bonkers in your case. We have done this before and it's okay. So I'm going to take you through this quite nice example of a wound. So this lady had a breast reduction, and she unfortunately developed some T-junction wound breakdown, and it can happen. I've got to say, it's not particularly common. It can happen. And the reason, if it's going to happen, it tends to happen at a T-junction, is because T-junctions are quite busy sites in terms of what we're doing. We tend to put the most suture material there to hold things together. The blood supply is worst there because it's got the furthest to travel, and it's at this tip, and you've got not just one but two healing surfaces coming together. It's all going on there. And it's often handled more as well. So you can get this, although it's not that common. And when it happens, if you're lucky, it might be suitable to put a stitch in. I used to say never, never, ever. Sometimes I do now, but only if we've got there really quickly and if it's completely pristine, clean, and very little time has passed at all before we discover it. And if it's been under a dressing for a while and then you find it, it's probably too late. I'm talking hours, not days. And we would just say, I'm just going to leave that to heal. And patients, this is how the conversation go. At that point says, what do you mean you're going to leave that to heal? That will never heal. Well, it will heal. What will happen to my scar? Will my scar be awful? Okay, so what tends to happen is your body, for myofibroblasts, which are a cell type, migrate into this area. They lay down scar tissue and they actually pull the edges of the wound together for us. So your scars actually reduce in size. At first you can get sort of, this looks like a stretch bit, it hasn't broken down, but it is widened, and that's very red. The redness goes, the width decreases, and so when I saw this lady the next time, it was looking kind of like this, and you can see that vertical wound has reduced in width, this has reduced in area, you've got new skin growing in, and then when you see her again a couple of weeks after that, it looks like this. And this is just when I saw her recently, but it's going to continue to improve. It's going to continue to get better. This is also still quite wide. I'm expecting further narrowing. I'm expecting further color changes. Now, once it's completely healed, then if you want to, we could go in and we could remove that, revise the scar, and make it look like this lovely, beautiful little fine, narrow, skinny scar there. But we tend to leave it a while, to see how things are going to go, and also to let the tissue settle down, soften, and so forth. So don't worry, we are not totally bonkers by doing nothing except wound care, dressings, keeping it clean. You will go from that to that. Bodies are wonderful things, aren't they? So this is to give you a bit of reassurance. I hope it has done so. Yeah, get back to us if ever you need us. Okay, take care. Bye-bye.